If you are a midlife woman or you're coming up on this powerful season of growth, this is the podcast for you. Welcome to Unraveling Together. I'm Samantha Graber, also known as Dr. Sam, seasoned holistic health physician and woman in the midst of midlife's unraveling. Unraveling Together is a place we talk about the things we just don't talk about, but so desperately need to as women. Together we untangle ourselves from our pasts and weave a beautiful web for a future we so deeply desire to bring to life. Grab a cup of chai, water, tea, or joe, and let's get to it. Perimenopause brain. It's like pregnancy brain, but then again, it's not. Pregnancy and perimenopause are both natural phenomena and unique to the female body. One common experience of both is a temporary change in brain chemistry. You're more than likely familiar with pregnancy brain. In fact, you may have experienced it firsthand or in sympathy with your partner, like that 15 pounds you gained alongside her. Similar, yet oh so different. Similar in physiology to the behind-the-scenes shift in the pregnant brain, there is a lesser-known experience unique to those of us wrapping up our reproductive phase of life. That side dish to the main course, which is perimenopause, that side dish is brain fog, or what I lovingly refer to as perimenopause or peri-brain. Pregnancy and perimenopause brain are similar in physiology as far as they both stem from changes in the hormones flowing around us, but our pregnancy brain resolves rather shortly after that pregnancy ends. In contrast, brain changes that accompany perimenopause can last much, much longer, years and years longer, in fact. Physiology aside, I'd be remiss not to mention that people are much more forgiving towards our forgetfulness, our word loss, and momentarily scattered selves when there is a baby on board. When it's perimenopause brain, those around us can be far less forgiving, especially at work. At work, a pregnant woman finds herself in a protected group. Not so much when that same woman transitions into her perimenopause phase of life. She is met, often rather harshly, with the progressive plagues of ageism and sexism. And if she is LGBTQ+, BIPOC, or another layer of non-cis and other than quote-unquote white, the ism stack can be crushing to her psyche, well-being, and her career. There comes a point in every woman's life when her body mounts a mutiny. Her mind rides shotgun and appears to be reading a map of Mars upside down. All in all, it is a tumultuous time and a downright confusing one as well, not to mention lonely. This time in life can be so very lonely. That was what I was experiencing a few short years ago, and I was doing it in the closet. Marinating in shame because I should power through it like I did every other thing in my life, just like a modern, independent Wonder Woman. To add to my should fest, I am a seasoned holistic doc with then 25 years of direct patient care under my belt, though expanding at the time, and I was completely blindsided by what was happening to my own body and brain right around the 45-year marker. You see, there is no powering through perimenopause. In fact, in my experience, the more we try to power through, the more peri pushes back. One way in which peri pushes back is through fogging up the old noggin, also known as perimenopause brain. It's not a tumor, nor is it early onset Alzheimer's. Everyone born with ovaries will experience a variation on the theme of perimenopause and may therefore endure the frustrations of peri-brain. Those who work with them, live with them, and care about them need to understand how this natural stage in a person's life can impact all aspects of their life so they can support the person deep in the throes of perimenopause. So here's a bit of basic biochemistry to get us on the same page. Menopause is technically one day. It is reached when we go 365 days without anything resembling our period. Menopause can also be reached through medical intervention and is effective immediately upon removal of the ovaries. This is a more abrupt experience than that of someone who experiences her full, natural perimenopausal transition. The abruptness also compounds and complicates the recovery period from all aspects. When a woman has had a hysterectomy or uterus removal and oophorectomy, ovaries removal, please be patient. She's undergone a massive change, and it may take her body and brain more than a short-term leave to adjust. Perimenopause is the period of time prior to our menopause, and perimenopause is reported to be somewhere in the neighborhood of 5 to 10 years. Look at it as the hormonal runway prior to the total rework of a female's hormone profile. Now, this runway allows time for our body and brain to adapt. The longer the runway, the less jarring during that final liftoff, so to speak. There's no medical test for perimenopause per se, and therefore you can't go to your doctor for blood work that shows a negative or a positive result. I've seen it noted that some 60% of women in midlife report experiencing undesirable changes in their memory as well as their cognition, which is that comprehension or understanding of concepts. Some women worry they have an early onset of Alzheimer's when left to draw their own conclusions without the right resources to consult. When these brain changes occur alongside changes in your menstrual cycle, it is more likely to be perimenopause brain than Alzheimer's. So just what is perimenopause brain? Perimenopause brain, also known as brain fog, is the culmination of issues traced back to the effect that midlife hormonal shifts have on the brain. It is one of the often noted 34 symptoms of perimenopause. Now, I don't prefer to use the word quote-unquote symptom here, for symptoms accompany a diagnosis, and a diagnosis is the medicalized name given to a disease. Menopause in all her stages is a natural phenomenon, not a disease. No disease, no need for diagnosis. Now, researchers and physicians often call brain fog a form of cognitive dysfunction when it occurs during perimenopause and the few years post-menopause. Now, I can get behind that consideration to a point. It's not a dysfunction per se, since it results from the body trying to adapt to the shifting hormonal landscape. Can you tell I have a problem with medicalizing a normal, natural transition of female life? Yeah. Perimenopause-related brain fog consists of lapses in memory. Think, why did I come into this room? It shows up as concentration difficulties. I just can't think straight. It shows up as trouble focusing, something along the lines of, I've started 27 things and completed none. It's the inability to recall that correct word or a person's name. You know, that person that you've known them for a while and you're looking at them like a deer in the headlight, that name just is not coming to you. Or possibly perimenopause brain can be a lack of mental clarity. It's like your head is literally in the clouds, that feeling. From tasks of daily living to trying to hold a casual conversation, our foggy brain can be a nuisance. Add stress to that, such as when we're at work or taking on an unfamiliar task, and brain fog can elevate from nuisance to downright interference. Now, there is a silver lining to the cloud, or at least the fog. Brain fog, that is. While many women experience perimenopause brain, studies indicate the situation will improve after menopause. It's been noted that perimenopausal women may score significantly worse on tests that evaluate short-term memory, learning through verbal means, attention span, and following verbal commands compared to postmenopausal women. All that to say, even if you are smack dab in the middle of this phase of life and you feel like you are living in a perpetual haze, there is a light at the end of the proverbial tunnel. And I promise, it's not some jerk with a flashlight, okay? So people of all genders can experience brain fog at any point in life. This is a common response to a heightened state of stress, such as when we're coming up to a big deadline or someone has just laid something pretty heavy on us. So what causes perimenopause brain? Short answer, hormone changes. Longer answer, abrupt fluctuations in our assertive sex hormones, which are your estrogen and follicle-stimulating hormone. Those layered upon a slow and steady decline in our nesting hormone, which is progesterone. All that to be hijacked by the wild ride of our stress hormones, most notably cortisol. I am not sharing this to alarm you. I share to inform you of what is at work behind the scenes and to help you prepare for these changes as you best can. Now, if you are in the throes of perimenopause and you feel as if your body and brain are in full-on mutiny, You can take the nautical wheel and right the ship, so to speak. The most impactful thing you can do is to get your stress response under control. Another highly impactful thing you can do is to shift your metabolism from that of sugar burner to one that favors fats. In other words, become metabolically flexible. Now you do this through adopting a way of eating that keeps insulin super low, so you resensitize your cells to insulin. Insulin resistance, which is rampant and an underlying factor in chronic diseases that catch up to us in midlife, insulin resistance is reversible and preventable. I'll say that again and a little louder for those in the back. Insulin resistance is reversible and preventable. I want to go on record, there is a big ol' asterisk on the play here. Just because you or others are noting changes in your cognition or your memory alongside those changes in your period, it does not indicate that you don't have early onset Alzheimer's or some other major brain issue. Having an established, holistic, whole self team in place is key to navigating the midlife waters and deciphering which peri-associated issues are just that, and which are ones to further explore. Brain fog is one thing. Dementia of any kind and Alzheimer's are a whole different animal. Though these diseases rarely impact us in midlife when perimenopause comes on scene, it is wise to tap into your whole self team's collective wisdom if you have a family history of early onset dementia or Alzheimer's. And in the same breath, the whole point of developing a whole self team is to lean on them when issues impact us beyond what seems reasonable. If you find your brain fog severely impacting your overall ability to function, this is the time to talk to your provider of choice. Perimenopause brain is temporary. Dementia and Alzheimer's are not. They are diseases that get progressively worse over time. Of note, Alzheimer's is also known as diabetes type 3 because it is noted to be insulin resistance of the brain, which occurs in response to persistent hyperinsulinemia, which is too much insulin in the blood. Look into that line of thinking if the topic interests you beyond that of the fleeting kind. There is a growing body of research. I find it fascinating how much we can do to not only treat and prevent Alzheimer's, but to possibly reverse this lifestyle-created condition. While you're going down this rabbit hole, look into epigenetics and how that affects what genes get expressed or switched on, and how we can affect that through lifestyle. Uber fascinating stuff here. Until next time, take good care of yourself and each other. Thank you for joining me on the Unraveling Together podcast. I'd love to turn this thing we've got into a dialogue. Follow me on LinkedIn at Dr. Sam Graber, where we can have conversations about all things midlife, perimenopause, and finding meaning through it all. If you want a deeper dive into exploring your midlife experience, consider joining the Unraveling Together community of rebellious midlife women. It is there that we roll up our sleeves and do the work. Unraveling Together is a resource hub, roadmap, and online coaching community curated by yours truly. We are navigating this time called midlife together, for we truly believe we are stronger together. And when unravelers are in need of an assist, they have all of us there alongside them.